Good evening. My name is Claudia, and today I will be presenting to you my capstone project. The topic of my capstone project is the effectiveness of prophylactic antibiotics for minimally invasive interventional procedures. The reason why that I chose this particular topic is I notice in the procedural area where I work there is inconsistencies of treatment when it comes to interventional procedures. It basically is dependent upon the doctor that day how the patient's going to be treated. So I wanted to do a little bit more research to find what is best practice for patients that are undergoing minimally invasive interventional procedures. So the objective of my capstone project is to discuss the prevalence of surgical site infection and also the classification of surgical site infection, recommendations for systemic review and evidence-based practice. So the prevalence of surgical site infections in the hospital, it is the second leading cause of hospital-acquired infections in the U.S. It can also lead to prolonged hospital admissions and also unexpected medical costs. But ultimately, sometimes it can also lead to death. So we are trying to reduce that risk and find what's best practices for our patients so that we don't overutilize antibiotics, but also treat the patient to prevent surgical site infections. So the preventive measures for surgical site infections, as I previously discussed, is one, of course, prophylactic antibiotics. Two could be also hand hygiene, that's also important, and also aseptic technique. Studies have statistics show that 40 to 60% of SSIs are preventable. Surgical site classifications. So prophylactic antibiotics guidelines were initiated to decrease the incidence of resistance to antibiotics. The recommendations were established 27 years ago by the National Academy of Science and National Research Council, also known as NAS-NRC. So they basically went ahead and made some guidelines on which procedures would need prophylactic antibiotics. So when this was established, they did implement this criteria all through the United States, nationwide I mean, and the classification is based on the probability of introducing infection passing into the procedural site or barrier. So they did classify also the wound. They put surgical incisions on the wound categories. So there is clean, contaminated, and also dirty. So the data suggests to treat based on organism-specific exposure. Also, they had to modify the classifications because it did not include minimally invasive interventional procedures because the introduction of the pathogenesis differs versus invasive procedures, so they did have to make modifications to the guidelines, and standards of application of antibiotics may not be applicable for minimally invasive interventional procedures. And they still rely on provider discretion to determine the clinical significance of prophylactic antibiotics for minimal interventional invasive procedures. So we're going to discuss now my PICOT question is in patients who are undergoing a minimally invasive interventional procedure, how does the administration of prophylactic dose of an antibiotic in comparison to no treatment with an antibiotic prior to the procedure reduce the risk of surgical site infection within 30 days post-op? So the way my search strategy for my PICOT topic is that I did utilize Florida State College of Jacksonville's Learning Commons, and I used academic data-based search such as CINAHL, and I also used Medline, full text, and also health and nursing. So I did have to use filters and limitations. I had to modify key terms. I also had to narrow the published range within 5 to 10 years, and also limiting to results only to research articles, because I wanted to get really good research, solid studies with this as it pertains to this subject. So keywords, I would use minimally invasive procedures, prophylactic antibiotics, and percutaneous interventional procedures. So systemic review is one of the articles that I chose, and it's a meta-analysis was conducted on the effectiveness of prophylactic antibiotics for the reduction or prevention of infection for subjects that were undergoing a total implantable venous access device, also known as a TVAD procedure. Utilized the database Medline and also PubMed for this, and data had to meet the preferred reporting items for systemic reviews in meta-analysis, which is PRISMA. So basically the article that I chose was a meta-analysis, and they utilized the PRISMA database to make sure that the validity of the data was reliable. On to the next. Thank you for your patience. Systemic review. So for the systemic review that I chose, they utilized 4 clinical studies were selected for the meta-analysis. 2 were randomized controlled studies, and the other 2 were retrospective studies. So the data include the following information. They included the total number of patients, antibiotics versus no antibiotics, also length of follow-up, and prevalence of infection. Once they obtained the data, they also used the MedCalc software to calculate the statistical data. The enrollment took place between 2010 and through 2012, and there were 2 treatment arms that we're looking at: antibiotics versus no antibiotics. The length of the study was 48 months, and they also had a 30-day post-op follow-up visit. So the results from the systemic review did show, so there was retrospective reviews, 2 retrospective reviews. The first sample size was 459 participants. So 459 patients enrolled in the study. And the second sample size was when the other second retrospective review, they had 1,183 participants. With the retrospective review, there is no formal criterion, unlike the randomized control study. That's the downfall of a retrospective review, and the treatment was based on the interventional radiologist, not on like a blinded study, which we'll discuss, like double-blinded. So a randomized control study, they conducted 2 randomized control studies. One study was prospective, randomized, and double-blind placebo control trial. That means that both the subject or the sponsor, they had no idea what arm the patient would be selected for. It was that means double-blind, and also placebo means that placebo means they could either get the antibiotics versus they could not get the antibiotics, but they did not know what the patient was going to receive. So the second study of the RCT was not a double-blinded study, which means that the sponsor most likely knew what the patient was getting, but the patient didn't know what the patient was getting. The sample size double-blind study contained 404 patients, whereas the sample size of the second RCT study only included 108 subjects. So with the randomized controlled trial, the subjects must meet inclusion-exclusion criteria, whereas the retrospective review, there really isn't a inclusion or exclusion criteria. So the results of the systemic review, the cumulative data is a total of 2,154 patients. So out of that, 441 was in the treatment arm of prophylactic antibiotics, which came up to 28.4%. And in the treatment arm of no antibiotics, there was 1,794 subjects, which equal to 79.5%. So 32 subjects out of all these patients, 32 subjects reported with no infection, and 5 were in the treatment arm. So 5 of the patients were in the treatment to receive antibiotics, which would translate to 1.1% of patients that reported antibiotics. So 27 were in the no treatment arm, which that means they didn't receive antibiotics. So only 1.6% of that particular group had reported infection. So basically what the data was showing is that there isn't a clinically significance between patients who received prophylactic antibiotics versus patients who didn't receive prophylactic antibiotics. Let's see. Some more data. So they calculated that estimate of 0.93, which a confidence interval of 95%, with the patients that overall were estimated with patients with antibiotics. And then there's 1.74% among patients without antibiotics. So the statistical data reflected that the administration of antibiotics did not reduce the rate of infection. So basically what the numbers mean is that the patients that did receive antibiotics versus the patients that did not, there wasn't any clinical significance in comparison to the patients that did not receive antibiotics. So the overall infection estimate was 0.93% among patients with antibiotics. And then with the patients who did not receive antibiotics, then the statistical data showed 1.74. So basically, in conclusion, the study shows there is no clinical significance for the administration of prophylactic antibiotics for patients who are undergoing TIVAD procedures. So we're going to go to the next slide. Do that one. So the national guidelines, I'm going to discuss the National Guidelines Clearinghouse. They suggest that prophylactic antibiotics is not clinically significant to reduce the risk of infection for patients who are undergoing central venous catheter placement. So central venous catheter placement is also considered a minimally invasive interventional procedure. So the summary of this is the literature review, the meta-analysis, recommended guidelines, the meta-analysis, patients undergoing TIVAD procedures, 30-day post-op was looked at, and also the recommended guidelines for patients receiving central venous catheter placements. So both procedures are categorized, like I said, as minimally invasive interventional procedures, and the data reflects that the administration of prophylactic antibiotics is not necessary for the prevention of SSI. Now, further research is needed to include other interventional procedures because we do a wide variety of interventional procedures, including TIVAD procedures and CVC. So the conclusion to my literature review is that for specific procedures like the TIVAD procedure and the CVC procedure, prophylactic antibiotics is not clinically significant. However, further research is needed for the other types of procedure, and as is now, it is based on physician discretion. However, there can be some modifications to how we practice on those specific procedures, seeing that it is not clinically significant to administer prophylactic antibiotics. And that is the conclusion of my presentation. Please fill out your questionnaire provided in the beginning of the presentation, and I'll be collecting them. Thank you and have a good evening.